So the objective of my talk, which is really just to add my voice, is to sort of highlight the current challenges that exist in Canada for patients that have scoliosis. I'm really here to advocate for early detection and initiation of early bracing. Even though I'm a surgeon, I can tell you that I'd be much more happy if we could treat patients without having to do surgery. And that it's really my role, and again, as the president of the Canadian Pediatric Spine Society, it's really to endorse movements like this grassroots movement that is crucial in being able to change the disease burden of our patients that have scoliosis. So here's the scope of our challenge, is that currently in Canada, at least as much as we know, the incidence of idiopathic scoliosis is between 0.5 and 4% of adolescents. And if you look at the number of children across Canada, there's almost 10,000 patients that need to be seen or screened to make sure that they don't have scoliosis. And unfortunately, the current healthcare system is doing a poor job of being able to identify these patients. And again, so if you look at a study that was published in 2021, the majority of patients that presented to specialists presented too late to be treated with a simple treatment of a brace. And that's really a dismal result. And that if you look at some of the challenges is that if patients did not have a primary care physicians, they were 2 times higher of the chance of having to have surgery compared to if they had a pediatrician. So the mere fact that somebody is looking at their back decreases the risk of him having significant spinal deformity, and thus is able to decrease the disease burden for that child. Now, the other challenge that we have is that if you look at x-rays, there's a study that came out of Toronto Sick Kids that 1 out of 4 x-rays were misread, resulting in a discrepancy in treatment of the current screening patients that were being referred to the specialists. So currently, the way that we're assessing and evaluating patients, we're missing a large component of them, and that the way that we're measuring them or assessing them is inadequate. And what's even more discouraging is that the same studies were shown in 2007. So in 2007, out of Saint-Justine, one of the referring hospitals in Quebec, 42% of the patients that were referred inappropriately. Essentially, they did not have any spinal deformity. Yet at the same time, 32% of those patients presented with late referrals, meaning that they actually needed surgery and they missed a whole treatment group. So there is an obvious inability to identify and refer appropriately and early the patients that have spinal deformity. And the best way to address that is really increasing awareness. And that, so how do we do that, especially in the current healthcare system where we keep being told you got to do more with less? And I think one of the best way of doing that is really what this whole advocacy group or coalition for screening for scoliosis is, that we need to improve awareness, we need to improve early detection, and we need to improve access to specialized care. And that what we need is really to reinstall obligatory school screening during the critical years when the kids are growing. And then we could do that also with the idea of using new technologies and changing our approach to emphasize prevention rather than active treatment. And this is where, physiotherapists and as well as orthotists really play a role. Scoliosis is a condition that a conservative treatment can prevent disease burden. So here's an example of a child that was identified at the age of 7, and that initiating a brace as well as physio, we were able to, over a period of 5 years, to be able to actually treat his scoliosis. And that's the X-ray at the top. And then we have another child that's sort of had a 70-degree curve, which is typically a surgical treatment, that we're also put in a brace and we're able to control that curve. So my message to the group really is early detection, increasing awareness allows us to change the way that we see and treat these patients, and that it's really through a grassroots approach, and all of us reaching out to our members of parliament to change the current laws and being able to help these children before they get into trouble. I wanted to thank Karen to allow me to just say a few words. And I think that Andrea said it extremely well, that, the ability to detect early, initiate physiotherapy, then we're really changing the way that our children are currently living with scoliosis.